Welcome, everybody, to the Jamaica Midlife Health Society third and final CME meeting. And tonight, it's on empowering my wellness in midlife and beyond. Where am I now? We have some excellent speakers. You can see the program, which is right in front of us. Embracing a healthier lifestyle and thriving future. And of course, we're going to talk about nutrition and a healthy body. We all want to keep young and healthy as long as we live. We want to be healthy and be able to enjoy life. I heard a little pun, not quite a joke, about I wanted to tell this joke about amnesia, the joke, but then I forget how it goes. And we don't want to be one of those people where we want to know what we have to say and we have forgotten. So welcome, enjoy from all of us. Have a great evening. And we're going to send you over for our opening prayer.
Thank you so much and welcome. So we're looking for Charlene. Charlene, can you unmute for me?
Charlene,
And please, thank you. Should see the option to unmute. There you go. Not hearing you. Afternoon again, everybody. Pre-test will be shared shortly. Charlene, are you there? Charlene might be having some audio difficulties. Seeing where she's unmuted, but not hearing her.
All right. If Charlene can't, Magna, do you want to actually pray for us?
Yes, I will pray. Charlene, giving you one more opportunity. If you're there, please tune in. If not, I will pray.
Microphone, yeah?
Dr. William, mute your mic. Dr. William, mute your mic. Thank you. Okay, good afternoon, everyone. Let us pray. Father in heaven, thank you so much for this opportunity you've given us to have our final 2024 webinar, JMHS webinar, speaking about addressing the topic of wellness. We all want to remain well, but we all know that wellness also requires personal responsibility. So as we listen to the presenters and get information about taking personal responsibility, that we will do so that we can live healthy lives for Christ's sake. Amen.
Amen.
Mm.
Mm-hmm.
Dr. Lisa, you're muted.
So you're muted. Sorry. Welcome, Dr. William Brown, who is our JMHS president. He'll give our welcome and greetings.
Thank you very much, everybody. Good afternoon. Today we are having our last webinar, the third in the series for this year. And we've entitled Empowering Wellness in Midlife and Beyond. Where am I now? And I'm going to add, where are you now? And so, you know, health and vitality are important at any age, right? And after 50, though you may think more about how to promote good health, as you get older, this becomes more important. When they are concerned about weight gain, sex drive, or chronic diseases, a big part of healthy aging is maintaining a healthy lifestyle. Now, what's a healthy lifestyle? We're going to discover in our speakers today. For example, eating reasonable amounts of a variety of nutritious foods and getting physical activity every day can go a long way towards staying healthy as you age. If an interest in healthy aging leads you to think about trying anti-aging therapies, be careful, you're warned, because supplements or expensive treatments can claim to delay or reverse the aging process, which may not deliver on their promises. And diets that strictly limit the types of foods you eat could be harmful. So know what you are buying, empowering yourself, and know how to spot suspicious schemes. Remember, there is no quick fix when it comes to healthy aging. The way you grow older is specific to you. Lifestyle, among other things, can play a role in the process. But some changes in your 50s and over are universal because they are the result of the way your body works. So don't be surprised. It is normal. Experts sometimes call this pure aging. They are aging purely. This is part of life's shifts. These shifts happen in everyone who lives long enough. You can't avoid them, but you can prepare if you know what to expect. You know, JMHS we've had a few webinars over the last few years. We've spoken about the mind, the heart, our skin, eyes, hearing, our immune system with COVID, our joints, sleep, we did sleep, our sexuality. So these are so many topics. And today we're just going to focus on how we put all these things together and empower ourselves towards the best wellness that we can afford. So on behalf of the Jamaica Midlife Health Society, the executives, the membership, I would like to welcome all of you and bring greetings to you as well, so that you can participate in this webinar that we have today fully, asking your questions online, directly live, or you can put it in the chat. And we hope that at the end of the day, you will have benefited for having spent a couple of hours in empowering your wellness for yourself and for your friends, colleagues, and family. Welcome all. Please sit back and enjoy. Thank you very much.
Thank you, Dr. Brown. And next up is our Vice President, Dr. Arna Brown Morgan, who will do the official opening of the webinar and introduce the next guest speaker. Over to you, Arna.
Good afternoon, ladies and gentlemen, colleagues, participants, and members of the Jamaica Midlife Health Society. It is my great pleasure to open this webinar today with the introduction of Professor Monica Asinani, who will give the opening remarks and address and greetings. Professor Monica Asinani is a professor of family medicine and epidemiology. She's also the director of the sickle cell unit of the Caribbean Institute for Health Research, that's CARE, at the University of the West Indies here in Jamaica. She's a graduate of the University of the West Indies, and this beautiful, talented, professional, and mother of two sons is one of the most distinguished graduates who has graduated from the doctoral program in family medicine in Jamaica, if not the most distinguished graduate. She is a very bright and accomplished lady, and yet one of the most humble persons I have met. She is Jamaica's first professor of family medicine. She is a people person and also a significant academic. And it has been, she has been associated with over 70 publications related to her passion, which is to alleviate the suffering of people with sickle cell disease, improve their living circumstances, and if possible, to one day cure sickle cell disease. I know this latter goal is in her heart, if not on paper. She believes that a major outcome in patient care is improving the quality of life of individuals who present as patients to their doctors, which includes not only managing their diseases, but enabling them to live fuller and richer lives through their behaviors that will now build their wellness. Professor Asinani is also very involved in lecturing and examining postgraduate medical students in family medicine, pediatrics, and urology, and at the University of the West Indies. And she's a PhD advisor to nursing, masters in global health at Duke University. It is her joy to contribute to graduating young doctors of the highest proficiency and ethics. She has also participated in the executive of the CCFP, Caribbean College of Family Physicians, and at the highest levels. It is now for me. It is now for me. I think I have, yes, I have said what I wanted to do. I wanted to say that she is very, very involved in the Caribbean College of Family Physicians. But Monica, I am so proud to be the person to introduce you here this evening. And it is for me now to declare this conference and invite Professor Asnani to give her opening address to this group and to bring greetings. Professor Asnani, thank you for being here and with us this afternoon, and over to you.
Dr. Brown Morgan, I am totally humbled. I did not send all of that for you to say, Dr. Brown Morgan. I'm humbled, especially since Dr. Brown Morgan was one of the seniors and continues to be a senior who I admire to the utmost. And she was also my program director when I was a young resident in the family medicine program, along with Pauline Williams-Green and so many other excellent seniors that I really admire and continue to learn from. Thank you so much for the introduction. It's way beyond what I am, and I'm really honored to be here. So good afternoon, everyone, family, colleagues, friends. It's a great pleasure to welcome you all this afternoon and for myself to participate in Jamaica Midlife Health Society's third of their 3 annual CME accredited webinar symposia for 2024. And can I tell you, it's a little bit shameful on my part. That is a first time for me attending their activities. And in the last few weeks since being invited by Dr. William Brown to participate today, what I have been reading about this organization is really heartwarming and just so important. Today's symposium is well titled, Empowering My Wellness in Midlife and Beyond. Where am I now? I wonder why Dr. William Brown thought of me. Maybe he knows that I have stepped into midlife, and what am I doing with myself and my wellness? So midlife is a period between the ages of 45 to 60 years, or maybe between 40 to 65 years. It depends on, aging and lifespans are really moving targets. But it's definitely the period that links adulthood and older ages. It's a time period which doesn't receive much focused attention, even from us who are healthcare providers. Nonetheless, it's a critical period during the life course. Whereas we have all been learning, especially over the last decade or two, about the importance, say, of the first 1,000 days of life to later outcomes. The Dohad theory, which is the developmental origin of health and disease, which speaks to the impact of early life growth on non-communicable diseases in later life, etc. We've all been learning about how to take care of the growing fetus and how to take care of the first 2 years of life. We as yet do not really approach this time period, which is the midlife, in a determined way, in as focused a way. We are approaching old age. Are we stepping into it in the best health possible? Health, remember, includes not only physical health, but mental and emotional health, social health, and spiritual health. Being in this life period myself, I know what I've been thinking a lot about in the last couple of years. I find myself seeing the fruits of my labor, or maybe my dislabor, really reaping what I've been sowing in my younger years. Body aches and pains from lack of movement, and a lot more sedentary lifestyle, especially being engaged in research and teaching a lot more in the last few years. It really is sedentary. The battle with losing the few extra pounds that are piling on as our metabolism really puts on gentle brakes. Skin changes, hair changes, along with mood shifts, maybe from hormonal deficits, It's a period where we really are facing in real time the decline in our bodies. Yet it's also a time that gets us to say, wake up, guys. Time to take control in our hands and actively pursue good health and wellness. We can no longer take it for granted what youth or maybe good genes allowed us to do. Midlife holds us accountable for a lot more. How can we start a journey that focuses on our wellness? There are many different angles that we need to address this from. William spoke to some of that. And I'm really waiting just as much as all of you are on the talks later on this afternoon from a very esteemed panel today, But in a nutshell, for me, behaviors to really activate in midlife will include strength training, critical to offset the declines in muscle mass, bone density. We all speak about aerobic exercise, which is also critical, especially important to cardiovascular and other health benefits. But strength training may be something many of us have never thought of doing actively in our younger ages. With perimenopause or midlife, because midlife, and I'm so happy that JMHS really covers men and women. Sometimes, not sometimes, many times we leave our men behind and we wonder why they don't seek healthcare, But midlife and perimenopause, we know comes along with possibilities of irritability, brain fog, For people like me, COVID and midlife kind of came together. So I don't know which one is doing what, but I know there's all of these things. Feelings of anxiety, maybe feelings of depression. All of these things are common. People in midlife can experience disrupted sleep. We can have changing libido, changing sex drive. All of these psychological, psychosocial symptoms will emerge for many of us for the first time. There are other cognitive function that get disrupted. Attention, memory, and executive functioning are all affected. We know that exercise, nutrition, sleep is important. They all contribute to healthy aging. But how about challenging ourselves mentally? I learned from a senior neurologist many years ago that one of the things to really delay cognitive decline, because there's not a lot we can do to stop it, is maybe challenging ourselves mentally with different activities, taking on stuff that we have never done in the past. And my mother just turned 78 this year. Over the last 10 years, for the first time, she started taking up the Sudoku, and she's a master. She learned to go on, for example, the internet and use Skype in those days, 18 years ago, when my sister, her youngest child, migrated. And she had no choice because, our telephone bills could be huge. So she learned to go on the computer and use Skype. And I think all of those things have really kept her sharp because she is sharp. Something we might ignore is social connections, and I'm really looking to see if we speak about that. I think we ignore it. This is a stage in our lives, the midlife, where our children might be, flying the coop. Our siblings may have moved away. We might be losing our parents. So our social connections that were really the fiber of our social being may be loosening, okay? Some of us in older ages will even begin losing our friends. But the importance, so social connections may be loosening, but social connections are so critical. In fact, studies are showing that social connectedness can be a key component of wellness and can lead to an almost a 50% improvement in survival. We need to be engaging in behaviors such as screening for diseases. We all know those. Look out for our heart health, examine things like cholesterol and diabetes, look out for cancers, and assess for bone health. Another thing that we need to be aware of, our daily stressors can increase. So be alert to them. Our responsibilities continue to grow. But on the flip side, the happy news is maybe we know to cope a little bit better. We have been through it a lot, but maybe our capacities are declining, even though our skills in coping might be better. So there is this and so much more to healthy aging and wellness that we need to equip ourselves with. We have a packed and really fabulous agenda ahead of us. So let's sit back and immerse in today's symposium. Once again, I'm really, really honored to participate, and I'm looking forward to learning some exciting new ways of easing myself and helping our communities to ease themselves into wellness. Thank you so much.
Thank you. Excellent, excellent address, Professor Prasad Ashani. I mean, I'm looking forward to the meeting even more. So excellent. Our next is coming up is an overview of JMHS. But great job. It makes me more excited of the meeting just having you here. Hello again. We're gonna actually give you a little time to do the pre-test questions. I thought they were just gonna pop up. But just a reminder to please do the pre-test questions. And then we're gonna have our sponsors. Two of our sponsors will give us a talk. One will be a video, one will actually be talking to us. Please listen. Without them, we couldn't have a meeting. So we beat both the sponsors, participants, and speakers. So over to the sponsors. Our first one is from T. Geddes Grant Distributors.
No, Lisa, they're not here. Please continue.
They're not here, none of them?
No.
Okay, well, let's go over to the introduction of our first speaker. We're gonna give them just
The
a couple
first
minutes to do
video,
the
sorry, the first video is from Indus sent a video, so I can play
Okay,
that and then you can introduce the first
okay,
speaker.
sure.
Apologies. So the pre-test is in the chat, everybody. Please let us know through the chat whether or not you're seeing it. You'll also see the Q&A function, which becomes important as we head into our first presentation. That's where you'll ask the questions for our presenter. Again, thanks for joining the Jamaica Midlife Health Society for their third webinar. As we were saying, Dr. Lisa, we don't like that final. Third webinar of the year, not final.
Third
Please
one,
enjoy
I agreed.
yeah, let's enjoy the video from our sponsor, Indus.
Welcome to the world of Indus, and we are happy to join hands with you to serve the humanity across the globe through innovative healthcare brands. In just 16 years, Indus has grown from 1 to 120 products in 12 therapy areas. Today, Indus has spread its wings globally and is now present in 30 countries with 150 professionals spread across geographies like Asia, Southeast Asia, Africa, Europe, Caribbean, and South America. Excellence is not an act, but a habit at Indus. Our world-class products, affordable pricing, excellent supply chain, strong field force, and good business practices have accredited Indus with many excellence awards like Federation of Indian Export Organizations Export Excellence Award, Farm Excel Award, Brand of the Year Award in Ghana, and State Bank of India Financial Discipline Award. What's more, now Indus brings you a 5-minute miracle. In today's fast and modern lifestyle, the incidence of heartburn due to acid reflux and GERD is alarming due to stress and busy schedules, overeating, eating irregularly or too quickly, eating just before bedtime, fatty, spicy and fried junk foods, caffeinated drinks, carbonated soft drinks, acidic juices and alcohol, and smoking. As published in many international journals, hyperacidity, acid reflux and GERD lead to heartburn. In hyperacidity, the excess acid from the stomach can move upward into the esophagus, known as acid reflux. As the lower esophageal sphincter, which joins the esophagus and stomach, becomes weak. Since the esophagus is not well protected like the stomach, the acid can irritate the lining and cause inflammation in the esophagus. This causes painful symptoms that can last for a few minutes to hours and can occur more frequently within a week. This chronic form of acid reflux is known as GERD, that is, gastroesophageal reflux disease. The major symptoms of heartburn due to acid reflux and GERD are a burning feeling in the chest, epigastric pain, a bitter or sour taste in the mouth, nausea after eating, regurgitation, frequent burping, flatulence and gas, stomach discomfort, difficulty in swallowing, sore throat and dry cough. The question now is, do regular antacids help? In hyperacidity and GERD, regular antacids can only neutralize the acids, leaving acid reflux unattended. To treat hyperacidity, acid reflux and GERD, Indus Life Sciences comes with a unique third-generation antacid named NewGel, which controls acidity, prevents reflux. NewGel offers balanced combination of alginic acid, magnesium hydroxide, dried aluminum hydroxide, magnesium trisilicate, and dimethicone. When a person takes NewGel, the raft-forming alginate physically blocks reflux through a unique mechanism. When alginic acid comes in contact with the gastric acid, the raft-forming alginate, which includes natural algae, begins to form a light but strong foam barrier known as raft. This raft floats on top of the stomach contents and prevents acid from moving upward to the esophagus. The alginate raft formula, containing balanced antacid components, offers a speedy onset of action in less than 5 minutes and provides rapid relief from acid reflux with effective neutralization of stomach acid. NewGel has long-lasting effects up to 4 hours, since the raft can be retained in the stomach for several hours. Dimethicone in NewGel is an anti-foaming agent. It reduces the surface tension of gas bubbles, causing them to combine into larger bubbles in the stomach, which can then be passed more easily by means of belching. Dimethicone thus relieves flatulence. Nugel is recommended in hyperacidity, GERD, gastroesophageal reflux disease, gastritis, flatulence, and as an adjuvant to NSAIDs. Nugel is available as Nugel 200 ml suspension and Nugel tablets with delicious mint flavor. Nugel is safe in pregnancy. Nugel is sugar-free, hence safe for diabetics. For patients with symptomatic pain due to gastric and duodenal ulcer, Indus also presents Nugel O, the alginate raft-forming antacid with mucosal anesthetic agent oxytocin. Oxytocin is a potent, safe, local anesthetic agent that provides prolonged anesthesia of mucous membranes, thereby offering prompt and prolonged relief of pain. Nugel O is available in 200 ml suspension with mint flavor. Nugel and Nugel O. Raft formation reduces intensity and frequency of reflux attacks. Works in less than 5 minutes. Offers long-lasting effect up to 4 hours. Sugar-free, hence safe for diabetics. Delicious mint flavor improves patient compliance. We thank the entire medical fraternity for supporting Indus in our journey towards better healthcare.
Thank you so much, Indus. Our next presentation, I'm going to introduce our next fabulous speaker, Dr. Jacqueline Elaine Campbell. She is going to talk about embracing a healthier lifestyle and surviving it. All right, so she is a multifaceted individual. She's a family physician and pharmacologist. She received her MBBS from the University of West Indies in 1988. She is a lecturer at the University of West Indies, but she also holds a Master in Philosophy and Doctor of Philosophy degrees in pharmacology, as well as being certified in project management. She's a host of the radio program Powering Your Health, and that's aired on Power 106. She's a newspaper columnist writing medically related articles in The Observer, and she has a book out, A Patient's Guide to the Treatment of Diabetes Mellitus. She's a volunteer physician with the Women's Health Network. Please welcome Dr. Jacqueline Elaine Campbell.
Trying to get my slides out. Sam, what am I doing wrong?
I don't think you're doing anything wrong, but are you on PowerPoint? Right now I'm seeing your Gmail, so we need you to be in PowerPoint.
Oh, here I am.
Here you are.
Okay. Good afternoon, everyone. Thanks for the invitation to deliver this presentation this afternoon, embracing a healthier lifestyle for a thriving future. So let's go. I have my timer on. These are our objectives. So we'll just start with the first slide, which is from the World Health Organization, which defines wellness. And it says here that it's the optimal state of health of individuals and groups, and wellness is actually expressed as a positive approach to living. You know, wellness is actually achieved when someone strives for balance in their life, and this striving for balance is we do this by making the choices to further our health and fulfillment. So wellness is a direct or has a direct influence on overall health. So you may be asking yourself now, what is health? So health, again, the World Health Organization's definition is not just the absence of disease, but is a state of physical, mental, and spiritual well-being. This is a well-known definition. So I said to my students that I'm a failed artist. So when I said failed, I would have loved to be an artist. So this is my own interpretation of wellness, just to demonstrate the fact that wellness refers to an overall balance of a person's physical, social, environmental, occupational, emotional, intellectual, and spiritual, well-being. So wellness covers all of these. So remember that health refers to a state where the physical body is free of disease. Wellness is not this. So wellness is really not taking medication. We have to be mindful of the fact that on one end, patients with, let us say, poor health engage the medical fraternity to treat illnesses. On the other hand, people actually focus proactively on prevention, and so they maximize with the aim of maximizing their vitality. So they would be adopting lifestyles that improve health, prevent disease, and enhance their quality of life and a sense of well-being. So wellness per se is proactive, it's preventative, and it's driven by self-responsibility for healthy living. So I'll just summarize it here that health is the goal, and wellness would be the active process of achieving health. The fact is that many times persons use the terms wellness and health they use it sort of interchangeably, but there are definite, there are distinct definitions for both terms, and you cannot truly have health without first achieving wellness. Many times persons wait until their health is severely impacted before they act, or they think, okay, then I'm okay, I'm already fit and healthy. Why fix it if it's not broken? The fact is that, this is gonna sound very philosophical. Improving your health is like climbing a mountain. Each peak you climb becomes the base from which you ascend to another higher range of mountains, and the peaks of which were previously regarded as unreachable. So what is a healthy lifestyle? This is the healthy lifestyle which many of us would be familiar with: the fitness and the exercise, healthy food and water, medical examinations, relaxation, active lifestyle, regular measurement. We're gonna come into that with knowing your numbers. The fact is that while you cannot choose the state of health, you can consciously choose wellness by living your life responsibly and taking these proactive steps for your well-being. So what does wellness encompass in midlife and beyond? I like this picture here because I wanted a picture, with some fabulous looking women. And this is the picture, you know what I mean? So midlife, as Prof. Asnani said before, midlife refers to the middle years of life, or middle age as it were, which ranges from approximately 40 to age 65. And there are many dimensions of wellness, and that is what I'm going to be speaking about now. So the first one is physical. That patient who said to me some time ago, I was talking to her about health and wellness. She said, boy, doctor, maybe I'm just too lazy. The fact is that when we look at physical wellness increases physical fitness. So by being physically fit, person would have an enhanced ability to prevent illnesses and diseases. Exercises would be stimulating a healthy mind and body, and a sedentary lifestyle can be avoided by increasing physical activity. And we know the various physical activities already. You can walk, you can cycle, you can do so many things. There's this video on YouTube, Walking a Mile with Leslie. I like doing that, so I've introduced that to many of my patients and so on. So that is physical fitness for you. But that is not the only thing, you know. The fact is that caring for your body to stay healthy, you have to care for your body to stay healthy now and in the future. I've told this to so many people. Last year when I did mission with World Women's Health Network, I met this gentleman in his 80s, and he said to me, Doc, if I knew I was going to live so long, I would have taken better care of my body. So this is something for us to think about. We know about the Ministry of Health and Wellness's Know Your Numbers program. And this is one in which persons are encouraged to know their numbers yearly, I should point out. Know your blood pressure, your blood sugar, your weight, your body mass index. Because what happens, you know, is that there are a number of chronic diseases, and the chronic diseases that we're faced, hypertension, we know that can lead to the development of strokes, kidney disease, diabetes with its multiple complications, heart failure, kidney failure, arthritis, which is mobility challenges, and cancer. The point is that the non-communicable diseases have negative economic impact, not only on individuals and society. So look at some of the costs of the NCDs. You can have the direct costs, but you can also have the indirect costs derived from loss of earnings. Let's just say, for example, the breadwinner becomes ill. There's going to be obviously a challenge in terms of getting enough money for the family to go on. And the fact too is that there's an increased prevalence of non-communicable diseases in elderly and non-elderly populations. And we are seeing this, whereby you have a significant increase in a number of persons with multiple non-communicable diseases. I want to point out here sleep. It is so very important that we think about sleep. The average adult is recommended to have 7 to 9 hours of sleep each night, you know. And when I looked at this, I know of people who will have they say they sleep 4 hours per night and they feel well. And I remember my mom telling me that her grandfather, he used to sleep 1 hour per night. And I used to say to her, but mommy, at that time, your grandfather, at that time, they didn't even have a TV. That time, what did he do? And she was like, well, he just stayed up and read. But the point is that the time is variable, yes, but the recommendation is between 7 and 9 hours of sleep per night. And there's so many things that can actually enhance our sleep, which would be having a sleep routine, nutrition, minimizing the intake of food 2 hours before bedtime, avoiding naps, minimizing distraction. I want to point out something here which is very important. Sleep deprivation can lead to a number of different illnesses or ailments, conditions. For example, fatigue, we know about the fatigue and the lack of energy, the memory loss, the forgetfulness. Some people don't like to use memory loss. They like to use forgetfulness. The changes in your appearance, you may look quite haggard. Weakened immune system, weight gain, yes. Higher stress levels, a greater chance of being involved in a motor vehicle accident, increased risk of cardiovascular disease, increased risk of the development of Alzheimer's disease, pre-diabetes, and thyroid issues. So it's a pretty serious thing here. And on the other hand, you have sleep apnea, which is linked to high blood pressure, heart disease, and arrhythmias. So we see that sleep is very, very important. So the next one that we're gonna look at physical will be intellectual. And as Nani had mentioned, we talk about mental exercise and engagement through learning, problem solving, and creativity. What those do is that they support intellectual wellness and promote a better attitude. So persons who learn new things challenge their minds and they can actually avoid mental health problems. I think of my father. My father is 90 no. Man, that man mind is as sharp as a tack. His mind sharper than mine, to be very honest with you, because he's always doing something new and so on. And I know so many other persons in their 90s who are very, very sharp because they're always challenging their brains. We're looking now at, yes, this is just to show stress killing me and you have to minimize your stress. We're looking next at emotional wellness. This should get its own webinar, to be honest with you. A person with emotional wellness can deal with stressful situations. This person is aware of their own feelings. This person has good self-esteem, has empathy towards other person's feelings, and all of these come towards developing or enhancing, I should say, emotional wellness. We have to focus on mental health. I was saying to a patient yesterday who had a number of emotional challenges that, you know, we need to learn about emotional regulation. I spoke to her about that. And also, in my opinion, mental health is even more important at times than your physical health because your mind literally governs that which happens in your body. I like this picture. It just shows, you know, just to be relaxed. It's, by the way, anybody wants to know, it's Jamaica in the veranda there. So we're next looking at environmental wellness. This is a picture taken from my garden. I have this big garden, you know what I mean? In fact, my computer, now I'm delivering this and I'm overlooking the garden with all the pretty flowers there and so on. And it really is relaxing. But awareness of the role that we play in improving our natural environment rather than say what's the word I want to say? Mashing it up, as we would say in Jamaica, and maintaining and living in a healthy physical environment free of hazards promotes wellness. So this is one way. The next one is social. This is my dad actually, and my niece in front of the birdhouse. So the social circles and support networks are very invaluable to the overall well-being of a person. So we're looking at the relationships, good relationship, good interpersonal relationships. We're looking at maintaining long-term relationships with your family, your friends. All of these keep a person happier and healthier. I want to point out here something which sometimes we don't really factor in. The fact that loneliness is it is so pervasive. I don't mean that you have some people who want to be alone. That's fine. We're talking about loneliness, and it's just not a feeling. It has tangible effects on our well-being. I see so many of my patients, my elderly patients, who live alone. They live alone. So they are alone in a house, or sometimes they may be in a house with other people, but there's not that interaction with the other persons. And loneliness can have a significant impact on mental and physical health. And this disconnection can lead to severe health consequences, increased risk of heart attacks, or heart disease, stroke, dementia. Yes, dementia, premature death. It is exacerbated by factors such as, the social isolation. We saw that with COVID, trauma, illness, even the pervasive use of technology. So many times you're around people, and what is it? They're on their phones, right? They're not taking any time to really connect with each other. They don't even really have dinner together. Sit down, let us sit down, let us say as a family or a group of people, and have a meal together. And this is very, very impactful on our health. I'm mindful of my 20 minutes, so bear with me. Now we're looking at spiritual connection. We know that some people like to go to church or their particular place of worship. Some people may not be, maybe they may not be like that, right? But the commitment to seeking meaning and purpose in human existence is very, very important. We should all have this deep awareness of the depth and expanse of life, and an appreciation of the natural forces in existence in the universe. And that's what we talk about, spiritual wellness. Then there is financial wellness. Managing your financial resources to live within your means and make important financial decisions is very, very important. So in terms of financial wellness, we have to consider your reasons. What financial goals are you trying to achieve? Create a budget. Things we know already, but we need to really put them down and really try to solidify this. Start investing early. Pay yourself first. When you have your paycheck, make sure you take out money for your savings. That's the first thing that you should do. Focus on debt. And remember that small steps have a big impact. The next one, very, very big, this one we call a biggie, would be occupational wellness. And this involves finding satisfaction in work and maintaining this work-life balance. It is an integral part of well-being. Rarely do we associate work with enjoyment, if ever. But the good news is that it is possible, to find joy in your work by making sure that we're in a career that meets our personal and professional goals, with places that have healthy work environments. The fact is that dissatisfaction with work, it happens over time, and it's quite possible to underestimate how much our occupational wellness is actually suffering. So if you have an excessively demanding or stressful work environment, it can, drain your energy. Really, it can drain your energy. So it leaves little time. You may not have any enthusiasm at all for socializing, for, as the people would say, doing me. As the young people say, I have to do me. Or you don't have any time at all. You don't have any time for your family, your friends, or so on. Because the stress within the workplace, can be wearing you down. It leads to burnout, and it can lead to a diminished sense of overall wellness. So it's important to be aware of how our work is impacting the rest of our wellness dimensions. Some are soon finished. So when any dimension of wellness is neglected, it becomes challenging to attain holistic well-being. So what can you do to enjoy midlife more? What are some of the benefits of middle age? Now, when I was younger, I mean, I thought that 40 was so old. 40-year-old people were so old. And then I actually got to be 40. Although I tell people I'm 26, but you get the point here. The fact is that midlife can be a rewarding time and it offers many benefits for people. By midlife, the fact is that by midlife, most of the insecurities of youth have faded away. Well, we hope so. And it allows us to be more confident in who we are and what we value. We become less selfish. Hopefully, we become less selfish, and we give more freely of our time and energy in the hopes of leaving a worthwhile legacy. You know, in the thing with being middle-aged and so on is that we may have fewer friendships, fewer relationships, and that may be due to relocation. So our friends or our families relocate. They can relocate to foreign lands. They can relocate to the cemetery. That is what it comes down to. And the ones that we have, I do believe we should try as much as we can to foster deeper and more meaningful relationships with these persons. So the question is, what does the future look like for you? Thank you for your attention. These are my references.
Thank you. Thank you so much, Dr. Jacqueline Campbell. Let's
You're
see if you
welcome.
have any questions, brief questions in the chat or in the Q&A. Sam, we have any Q&A questions?
Not seeing any Q&A yet, but there's a lively discussion in the chat.
Yes.
Persons are more so having conversation and dialogue sparked by what they heard by Dr. Jackie
How do
versus
we
asking
actually,
questions.
I have a brief question.
Sure.
We all talk about loneliness as we age. How do we help that? Because I think especially since COVID, I think people are getting lonelier and lonelier. I think I was at a presentation a few days ago, and they're saying we have to do less online and more together so that we associate again. But what do you think are your solutions?
One has to be very intentional as you get older. I do believe intentional in terms of the associations that you have. So you have to be intentional about the community. Where do you want to be? All right. I would like to be friends with that person or to have that person as an acquaintance. Or let me say, I would love to learn to paint, or I want to learn to have better plants or something like that. Okay, I can say that because I'm a gardener. What do? You could join a particular group of persons who are like-minded. And so by doing that, that doesn't mean that you're going to get any friends out of it, if you get me. All right. But you would at least be connecting with other persons, so you can, in essence, become less lonely.
I was agreeing with you that many of our patients that are older, we notice them to be quite lonely. And I was trying to think of what could we do as physicians or people in the community to help that, because it is an epidemic, both here and international.
Yes. What I found, what I discovered in my office. So I have a family practice and it's a house. So there's a veranda. And what I realize is that there are some persons whose visits literally coincide. So, you know, their checkups and so on. And I have found that many of my patients have struck up friendships with each other. So you say to yourself, oh, Miss X, you know, why? I said, yes, you know, we met while sitting down on the veranda waiting on you. So they will socialize and so on. I haven't heard of any relationships or any marriages or so, you know what I mean? But I've met quite a number of persons I have found that has happened with, and quite a number of persons have formed relationships with my receptionist and also the office attendant. Is the most interesting thing because these two ladies, they're they're wonderful human beings. And so the patients gravitate towards them. Yes, so that is what I have found.
Well, thank you. Thanks again. I think
You're welcome.
in the chat, a lot of people are telling you excellent presentation. Very
Thanks.
We do
well
have one
received.
question.
Go ahead.
Andre Sheppy asked, which of the dimensions would you consider to be the most pivotal if you were to purport one as the most pivotal?
Ah, whoa. That's a good one. I would say the most pivotal would be physical because the physical covers so many different things. So we're not just thinking about the physical exercising as so. Under what is going to impact your physical wellness will be your nutrition, also your mental health, stress, and so on. So if I had to choose one, I would choose that one.
Any
All
more,
right,
Sam?
thank you very much. No more.
Well, thanks again. Thanks again, Dr. Campbell. Excellent.
You're welcome. Thank you.
Over again now to our sponsors. I think we have video presentations, correct, Sam?
Right, we have a video presentation from Health 2000,
2000
and then
Canada.
Paul is with us to do a presentation live from Abbott.
Over to
One
our
moment.
sponsors.
Definitely.
Good day. This is Health 2000 Canada, or H2K, a generic pharmaceutical company proudly serving Jamaica and the Caribbean from 1999, bringing you products made with the best ingredients, delivering efficacy, quality, and safety at affordable prices. Our products are distributed by Health Brands to pharmacies island-wide. Highlighted today will be our over-the-counter products that can be useful to you, your family, and your patients. H2K Vitamax Multivitamin and Mineral Syrup. Vitamax is great for the entire family from age 1 to adults. H2K Vitamax is one of the most complete multivitamin and mineral syrup on the market today, excellent for boosting your immune system. Research shows that our diets lack an appropriate amount of vitamins and minerals, so if we're not eating 4 to 6 servings of fruits and vegetables per day, we may fall in that category. Do you? Dietary supplementation in the form of Vitamax provides a way to prevent deficiency. It contains 11 of the daily essential vitamin plus minerals our body needs, including vitamin A, vitamin B1, B2, B3, B5, B6, and B12, vitamin D, vitamin C, L-lysine, magnesium, calcium, ferrous gluconate, which is a form of iron. So, what you see is a carefully designed preparation with optimal performance of your body in mind. Vitamax helps to support and boost heart health, mental and physical energy, your immune system, digestion, eye health, healthy joints, and bones. Vitamax is fortified with 75 milligrams of L-lysine, an essential amino acid important for proper growth and development. L-lysine helps to boost fat loss, helps to slow the aging process, improves hair appearance, smooths the skin, and helps to reduce wrinkles. It also boosts appetite and plays an important role in bone and tissue health. Vitamax sweet pineapple flavor without added sugar is a hit with everyone. Good. Safe for diabetics. So it's a thumbs up for Vitamax. Great for adults and children. H2K Silvacant Silver Sulfadizine Cream provides fast relief for second and third degree burns and prevents infection of burnt surfaces and chronic ulcers. Borototal Neem Cream, an Ayurvedic antiseptic cream that heals, soothes, moisturizes, making it the perfect companion, the power-packed herbal alternative for wound healing and skin infections. Borototal Neem Cream reduces topical pain, calms minor skin inflammation, fights minor skin infections, and promotes skin healing. Neem provides a wide spectrum of antibacterial action. Aloe vera has anti-inflammatory and cooling properties which soothes and speeds healing. Sesame seed oil treats inflamed, irritated, and damaged skin as it has high antioxidant and antibacterial properties. Asoka is an astringent and helps reduce irritation and burning sensations in the skin. Licorice stimulates wound contraction for a better healing outcome, and zinc heals and rejuvenates the skin. Borototal Neem Cream is locally recognized and effective for the diabetic foot, that thin, dry, papery skin that is prone to ulcers forming. Borototal is effective and useful when treating nappy rash, dry cracked nipples, blisters and burns, acne, insect bites, and much more. You can apply Borototal 2 to 3 times per day over the affected area. Try Borototal Neem Cream. You're gonna love it. H2K Naturella 5-in-1 Cream, formerly known as Brown and Beautiful, contains licorice root extract, niacinamide, lactic acid, and ursa leaf extract. Use daily for youthful-looking skin. Stay flawless without bleaching with H2K Naturella. H2K Go Gel provides quick relief for muscle, joint, and back pain. H2K Go Gel contains diclofenac, linseed oil, menthol, methyl salicylate, and capsaicin. H2K Go Gel delivers medication right to the site of your pain to keep you moving and gets you going beyond your limits. H2K Go Gel. Please follow us on Facebook and Instagram. Team H2K thanks you for listening. We look forward to partnering with you again in 2024 and beyond. All our products are available in pharmacies island-wide. Please ask for it. Thank you and have a great day.
Thank you, H2K. And now over to Abbott. And our rep is Mr. Paul Russell. Paul, you there?
Yeah, I'm here.
Over to you, sir.
Okay, thank you.
No problem.
You see my screen with the Abbott A?
That is correct.
All right. Good afternoon, everybody. My name is Paul Russell from Abbott Nutrition, and I'm excited to be presenting at this third Jamaica Midlife Health Society webinar and to showcase some of Abbott's products. Now, Abbott's products cover all stages of life, from infants through young adults, the aging patients, and persons with special health needs. So today we're going to look at a few of these products. The first one being Ensure. Now, Ensure has several products widely available on the supermarket shelf. But first, the patient needs to find the ideal Ensure in order to reach their nutritional goals. So today we're going to highlight 2 Ensure products. The first one we're going to be looking at is Ensure Max Protein Shake with 30 grams of protein, 1 gram of sugar, and a 4-gram fiber blend with a prebiotic which supports digestive health. Ensure Max Protein can benefit persons recovering from injury or surgery, or persons requiring extra protein, and it comes in assorted colors. Our second Ensure product is Ensure Plant-Based Protein Shake. Now, Ensure Plant-Based Protein Shake is vegan friendly, vegetarian friendly, it's dairy free and soy free. The protein is 100% plant-based, sourced from fava beans and peas. It's ideal for persons who prefer a plant-based protein nutrition shake. It has 180 calories, 20 grams of protein, and 5 grams of fiber. Shifting over now to Glucerna. For persons living with diabetes, there's a new kid on the block, and it's called Glucerna Protein Smart Shake. It has 30 grams of protein and only 150 calories. Now, this product can be a replacement for a poor meal or a snack choice, or for persons requiring extra protein. Next product is Pedialyte, and this summer has been extremely hot. And to replenish fluid and electrolytes, Pedialyte has a variety of products to help keep persons hydrated. Pedialyte is not just for kids anymore. So to remain hydrated when exercising, undergoing excessive sweating or extreme heat, or just dealing with vomiting and diarrhea, Pedialyte gives coverage for all. And my final highlighted product is Juven. And for hard to heal wounds, such like pressure injuries, diabetic foot wounds, surgical incisions, or other acute and chronic wounds, there is Juven. Juven gives patients the nutritional support for wound healing. In just 2 packets of Juven per day, mixed in 8 to 10 ounces of liquid or food, has been clinically shown to support wound healing by enhancing collagen formation in as little as 2 weeks. I've included my business card with my cell number 489-6093 and my email address at paulrussell@abbott.com. Feel free to contact me should you have any questions, queries, or concerns regarding any Abbott nutritional product. Our products are distributed by Caramed Limited, now called Caramed Group, at 20 Lady Musgrave Road. I thank you and continue to have a great webinar.
Thank you.
Thank you. There was a question, Magdalena, from actually our VP. I just was looking for it, that we missed. Arno, do you want to just ask it in person? Because I just missed it in the chat. I was just answering.
Okay.
Arno, go ahead and ask your
all
question,
right, then.
Dr. Campbell.
Right. Well, basically, I was asking Dr. Campbell, as we age, we see more and more of our friends passing. And sometimes there's a point where you see a lot passing. You know, this requires a whole part of wellness. It's a whole new portion of wellness that we need to really focus on. And then in addition to that, when you're a caregiver and you worry at times about the health of the person you're caring for, and this pressure and stress as to their health and your health too. Just wanted to ask Dr. Jackie about that. How she copes with it and how she thinks, what she can suggest.
I think it actually, can you hear me?
Yes.
I think it all begins with your sense of self. You have to have a really strong sense, a spiritual sense, as it were. You know, your sense of self and how you view yourself in the universe, as it were. And looking at all of these people who they are sick, you're literally grieving what is happening to this person. So you're grieving the loss of this person. So the person has not really, the person has died in a way, but the death is not a physical death. I don't know if everybody's getting what I'm saying. All right. So you literally have to go through a grieving process there. It's hard. So you have to look on it, Arna, in a number of different ways. You have the anticipatory grief, which many of us actually go through. And then you have the grieving, as it were. Have I answered the question or commented?
Yes, I guess there is much more too in terms of this sort of situation being an ongoing situation requiring a daily living. You know, I have a lot of patients and a lot of friends who are in this position and also in the position of their own health deteriorating. And I think no one has prepared us. This is why the JMHS is serving a purpose too, because no one has prepared us. Even in medical school, we weren't prepared for this whole aspect of aging or dying.
You know what is important? We see this happening with, especially with those persons who have dementia. All right, especially with dementia. What needs to happen, I firmly believe, is that we need more support groups. So you have the various support groups. So there's a dementia, there are maybe at least 2 dementia support groups for sure. And these are groups that people can literally join and they can get the support. So you get the support now. This is what is happening to me at my house with this particular individual. How do I deal with it? All right. So we need more support groups. We need to really support. We need to really support. Sorry. We really need to support each other. That is what we really need to do. So the key to all of this is support. And many persons are actually afraid to ask for help. That is what is happening. Many persons are afraid to ask for help. Or sometimes they're afraid to ask for help, or they may not know how to ask for help. They don't know where to go. And that is why societies like this society and also the different medical societies, or in whichever way we can, if we can start a support group, let us do that and help people.
All right, thank you. I hope that
You're
helps.
welcome.
Can we put in the chat some of those support groups? If possible, it would be helpful if we can put in the chat for people, or send it to an email afterwards and we can actually put it on the link afterwards when we put it on YouTube, if you can't find them today.
I'm going to send Deborah Calendar's phone number. She's with dementia, for sure. I'm going to send her number. Okay.
Okay, thank you. Now I'm going to give it over to my co-host, seems like a doctor, but Miss Magdalena Coop the News. Over to you, ma'am.
Thank you, Dr. Lisa. Good afternoon, everyone. It is indeed my pleasure to introduce Ms. Shani Jones from NCU. She's an assistant dietitian, nutrition specialist with over 10 years of progressive experience in the field of nutrition and dietetics. An experienced educator with over 10 years of progressive experience in the teaching and learning environment. Key areas of expertise for her include established collaborative relationship with key stakeholders, spearheaded changes in the food, I really like this, food environment of hospital, assessment and counseling of various clients and varying conditions, food service management, created menus to be used in hospital setting, organized and executed nutrition week activities, and innovating and creating of new products. As I said before, she's a Northern Caribbean University instructor, and her CV has noble characteristics of where she is now and why she has been selected to do the presentation for this afternoon. So it's now over to you, Doc. Miss Shani Jones, I think I can call you Doc, but based on what I see here, over to you.
Share screen, slideshow from, oh, turn on camera. Yes.
I
From the
also
beginning.
forgot to mention, sorry, I also forgot to mention, I am also very much acquainted with NCU. So when next time down there, I'll come and look for you.
Sure. Thank you so much for this opportunity to present. Not a doctor as yet, but of course, positivity into the atmosphere will bring seed. Yes. So thank you for the invitation to present this afternoon. I also love to do a lot of backyard gardening, and it has saved me a lot of money where tomatoes are concerned. Yeah. But let us enter our presentation. Fuel your wellness, building a strong foundation with nutrition. So our objectives here this afternoon: understand the importance of diet and nutrition in midlife and beyond, debunk some common nutrition myths, explore evidence-based dietary recommendations, integrate holistic wellness practices for overall well-being. The importance of nutrition in midlife. Timer. Yes. Changes in metabolism occur as we age. When we are born as newborn babes, we are changing, we are growing, we are developing, we are using a lot of energy. We are building muscle, bones. Hormones are shifting. Having gone through that baby stage now into puberty, another set of changes are happening. So in midlife, it's another phase of change that occurs. And aging happens naturally in the environment, in nature. We cannot stop aging from happening, but we can practice healthy decisions and choices that will help us go into a healthy lifespan. Increased risk for chronic conditions like heart disease, diabetes, and osteoporosis are also some of the conditions we can get while we age. Key nutritional needs for midlife and beyond. As we said before, muscle mass, we start to decrease in muscle mass because of aging. Bone density because of aging. When we were younger, we were active, we could sit up, we could sit on folded legs. The other day I saw a baby just squatting down, just regular squat, and then he rolled over to walk. I said, look at that. Can we squat like that and then just roll, crawl on our hands and knees? No, we're in pain. We have lost the ability to do so because our work environment and space, our homes, when we get to church, we are not using all the muscle groups and joints. So we begin to lose them. So we need increased protein intake for muscle maintenance, adequate calcium and vitamin D for our bone health, and of course, sufficient fiber for digestive health and cholesterol control. Common dietary challenges that we face during midlife is weight management is one of those primary ones, especially women with the shifting or ovaries deciding to downregulate, to slow down and not produce eggs anymore. Then we have that, we don't have that extra protection anymore of the estrogen. We start to put on waist in the abdominal area. So we have waist management issues happening there because it's a slowdown. And our bone health declines. We stop jumping, we stop skipping rope, and this increases our risk of fracture. Managing chronic conditions like hypertension and diabetes are also the challenges with midlife and beyond. In the Ministry of Health in 2015, a food-based guideline was developed. This is a picture of what it looks like. And you will notice that exercise is at the bottom, regardless of whether you're older person, younger person, physically challenging anyway, it doesn't exempt you. We are all supposed to be doing some form of activity. And then the lovely pie chart shows that most foods should be whole foods, unprocessed foods. Half the pie, vegetables and fruits in their natural form and state, unprocessed. Then we have our staple groups, which are a little more than a quarter, also unprocessed whole foods, legumes, nuts, seeds, food from animal, and the fats and oils you notice is a very tiny slit on the pie chart. But as a population in Jamaica, you know, we want fried chicken with curry gravy and it has to be swimming on the rice. So we, on a daily basis, our plate don't necessarily look like this, but this is where we want it to be so that we can go into midlife and beyond healthy. An overview of carbohydrates and myths and facts around that. All carbohydrates are bad. That's the myth. The fact is, complex carbohydrates are whole grains, are beneficial for our health. Carbohydrates are necessary for energy. Most of the cells in our body prefer using glucose, which is carbohydrate. Yes, but we choose whole grains over refined and processed carbohydrates. So the pastries, the fried pastries, fried foods, highly processed foods, we want to limit the amount of that. If we can completely take it out of our diet, that would be good. Refined carbs like our white bread, sugary snacks will spike the blood glucose levels, and this we want to limit. So when we consume our whole grains, the fact that these foods in their natural state have fibers in it, right? They help to slow down the transit time in our GI tract, and as such, the body is able to regulate itself a little better. So we get more essential nutrients and fiber, which helps to support our digestive health and stabilize our blood sugar levels when we eat whole grains, fruits, vegetables, ground provisions. The fiber helps to maintain our healthy bowel movement, lowers our cholesterol and our blood sugars. Carbohydrate recommendations for midlife and beyond. Of course, when you visit your nutritionist dietitian in our healthcare system, we have them in health centers, hospitals. We emphasize whole grains that are nuts or whole wheat products, but they are better able to break down the exact amount of carbs you would need, right? So limiting refined ones from this perspective, when we leave here, we know that we're going to cut down all the sugary, sweetened, fried and fatty foods from our diet and eat more wholesome ones. Fiber should be 25 to 30 grams of fiber per day. And if we are eating whole foods, this is not going to be an issue with the fiber, because then if we are eating the food in its natural form, we have stewed peas, we put maybe some nice yellow yam, know that nice dry negro yam, and we have that there. We have some vegetables on there, maybe some pumpkin, we have some greens attached to that. And at each meal, we are having whole foods. We are actually also building fiber at the same time. So we are not having to sit aside and say, oh, the fiber, oh, because we are trying to incorporate everything by having whole foods. Overview of proteins, myth and fact. Myth: high protein diets are harmful to older adults. Adequate protein intake supports muscle maintenance and overall health. As we age, we are losing muscle and we're losing bone. So it can't be that it is harmful for older adults to have protein. The excessive protein intake can have a strain on the kidneys for persons who have pre-existing kidney conditions. But for a healthy person without any of these chronic non-communicables, protein is recommended to help maintain that muscle mass. Protein is crucial to prevent sarcopenia, muscle loss, and maintain our metabolic rate. And our bodies use protein for a number of things. It helps to build our immune system, so all those immunoglobulins and so on that we need, protein is used for that. Our muscle building and repair our joints, our connective tissue. It is useful in all parts of our body, building and repair. So it is important for protein to be included in the diet. Source of protein: lean meat, lean meat. I know the culture here we have in Jamaica is some persons will see a jerk going on the road and they want the piece of jerk meat with the big fat on it because that they say is a nice piece. No, you want it to be lean, no skin, no fat. Yes, dairy, eggs, legume, your nuts and seeds for those people who are away from animal products, legumes, nuts and seeds. The protein recommendations for midlife and beyond recommended intake of 1.2 to 2 grams of protein per kilogram of your body weight. And your protein source should be included at each meal because it also helps with satiety, meaning you feel full, like you have something in your belly and not craving to eat more on top of that. When we don't have enough of our fiber-rich foods, of our protein, we then feel hungry, we feel a craving, and we say, let me add some more food. And usually it is high in calorie and low in nutrients. Yes, so we want to have adequate protein intake. Or fats and cholesterol. All fats are harmful and increase cholesterol. The fact is, healthy fats are essential for our health, our heart and brain health. Trans fats, excessive saturated fats, are those things we want to pay close attention to because they will raise the LDL or the bad cholesterol that is present, right? So, as I said before, highly processed foods, donuts, cakes, buns, these prepared juices that sometimes we don't read the labels properly. So we might think we're having one serving when we drink the bottle. When you turn it around, you're having the whole bottle and it's 500 calories of all sugar. Yes, so we want to read. Fact is, unsaturated fats found in our avocados, nuts, and olive oil can lower our LDL, which is the bad cholesterol, and raise our high-density lipoprotein, which is our good cholesterol. That's the one we want to have in our system. And people, we know, we have a saying, we dig our graves with our teeth, or crave and choke puppy. I don't know if you've ever heard that one. Even though it is good for us, it doesn't mean that we're just going to dive off in a bath of avocados because yes, it is good for us. But moderation is key. The good Bible tells us moderation is key in all things, right? Especially our Jamaican people when it's mango time. We can't eat one. We need 6 of everything. Fact, healthy fats are crucial for our heart and brain health. The omega-3 fatty acids that are found in our fatty fish and flax seeds help to reduce inflammation and support cognitive function. As Doc had said in our presentation before, as we age, we need to be supporting our intellect as well. Healthy fats also support our hormone production and nutrient absorption. So the focus should be on consuming monounsaturated and polyunsaturated fats and limit our saturated fats to less than 10%. Yes, so those are red meat. We want to make sure that it's lean, or if we can cut it out completely, that would be fantastic. And then we just include more omega-3 rich foods like our salmon, flaxseed, walnuts. Micronutrients and the supplements. The myth: supplements are unnecessary if you have a balanced diet. The fact is, certain micronutrients may be difficult to obtain through the diet alone, right? And so we have to fill those gaps with supplementation. But we don't just jump off the bat and supplement. We have to go to our physicians, get a full assessment, and then we can take it from there. Whole foods, primary source of our nutrients. The supplements will help to fill the gaps, especially for vitamin D and vitamin B12. Deficiencies in key vitamins and minerals can lead to health issues like bone loss and anemia. I was in a health presentation yesterday at AY in church, and Dr. Newman was presenting on prostate health. When the gentleman came to him, he gave a case study of a gentleman coming to him with prostate cancer, and it was advanced to this stage. He couldn't feel that middle part, and he was losing weight significantly. So he just gave him general guidelines to improve how he ate. When he came back for follow-up visit, he was looking so much better. But the fact is the cancer had metastasized and he passed because of a complication of that. So just changing his diet initially got him back up on where he was. But because the cancer had done damage to the spinal column, he fractured that, paralysis happened, and then, that was it. But it just goes to show that once we make the change, regardless of when we make that change in life, we are better able to improve our health, how we view life, or what we see. Certain vitamins and minerals are vital for aging. Vitamin D, crucial for calcium absorption and bone health. Vitamin B12 for our nerve function and our red blood cell production. Calcium is key for our bone density. Recommendations for micronutrient intake and supplement use. We consider supplements for vitamin D, calcium, and B12 if the diet is not sufficient. Prioritizing foods that are rich in essential vitamins and minerals, such as our leafy greens and plant-based grains and fortified cereals, will help to increase these nutrients in our diet. Hormonal support and nutritional needs. Hormonal changes during menopause and andropause can impact metabolism, bone density, and muscle mass. People tend to forget andropause. Nutritional strategies include increased calcium and vitamin D intake, and of course, adequate protein to counteract the muscle loss. The role of physical activity and exercise. Strength training, so we're lifting weights, right? You fill your wash tub with water and you lift it. That is a weight that you're lifting. Aerobics, you're walking, you're skipping. Flexibility exercises, you're doing a bit of yoga. We're going to be exposed to some yoga exercises later on. It helps to maintain our muscle mass, support our cardiovascular health, and improve our mental health. Now, we have to choose our heart. We have to choose our heart. I started the gym last year, and it is hard. Yes, I can lift heavy, can do the things, but it is very hard. I shifted my time. I now get up very early in the morning. I'm by the gym at 5:30 in the morning. I'm in the gym, sweating away. It's very hard because your bed calling, your bed say, come, stay by here, do not move. And you decide that yes, and then you drag yourself out to get ready to go to work and fix children and everybody in the back drop off who need to drop off, and you're on your way. But we need to choose our heart. If we want to have a healthy lifespan, we have to start somewhere, and it's going to be difficult to start because change is hard. So we need to choose our heart. And then after a time, it becomes a habit, and that habit just is normal. That's a part of life. If you don't do it, you just feel out of this world. Yeah? Avoid caffeine and heavy metals before bed and ensure adequate magnesium intake. So the persons with nuts, who eat nuts and seeds, your magnesium is going to be there. So you have in your system, but then it can be supplemented as well, as our physicians here will say. Our lifestyle changes, regular sleep routine, practice relaxation techniques, regular sleep routine. If you wake up early like I am doing and get up early, there's no doubt as the sun goes down, as people would say, as chicken ready to go in, I am at that point. My body's ready to go to sleep because I would have gotten up early, that early sun hitting my retina, getting my whole body set for the cycle to go through the day and to end the day. So we have to start healthy patterns if we want to see different. We learn, we understand, we see our family members, we see everybody go through some things. If we have learned and gone through, we don't need to follow that same path. Genetics has shown, but we don't need to follow that path. We can make different decisions. So we just need to choose our heart. So recapping our key points, let me see this timer. Nutrition, essential for maintaining health at midlife and beyond. And we debunk some of the facts about our macronutrients and supplements. And holistic wellness includes combining physical activity, mental health, and optimal well-being. focus on a balance and mindful eating and consistency. We're not just sitting in front of a computer screen and we're just eating, just going. We are mindful eating, all the distractions, focusing on the space and the time, being present in the moment, including a variety of foods, staying hydrated, especially in this heat, and enjoying your meals. Right? This is just a picture of me doing my little backyard garden, my tomatoes that I don't have to pay thousands of dollars for, even though Beryl tried to blow it out a little bit, it's still cut sideways and it's doing its thing still. And vegetables, see, my little broccoli, they started to open as flowers, but still edible. And of course, I planted my cactus, dragon fruit cactus in 2021, October, November. And last year it fruited for me, it flowered. So beautiful, I was so excited. This year it gave me about 8 fruits, fantastic. So I know next year I'm going to get bumper crop from my dragon fruit. So we need to plant things. You don't need a big space, because all of these things I'm showing you is a little tiny space that it is in. It's not no big space for it to grow. You cut your cactus around a back fence around the corner, because the cactus, it will, you know, and you're good to go. Yes? So we try to incorporate more colors in our life, more whole foods in our life. Thank you for allowing me the space and time. That very questions. A church fan. No questions?
Dr. Lisa? Any
So
question?
actually, there are a few questions. Could you give an example of what the protein daily allowance looks like?
Timer. Okay. The protein allowance would look like, say, for example, you're having, as recommended by Ministry of Health, you'll be having about 5 servings of food from animal. So that is 5 ounces. So you would have for a day, maybe a chicken breast in one setting and 2 eggs, right? That would be 5 servings. You have another protein attached to that, maybe a chicken leg. That would be it for the day. Not like our Jamaican setting where we have half a chicken at lunchtime. Then in the dinner time, we have the other half of the chicken. And at breakfast, we had a whole, no. Yeah? Depending on our activities, however, that may vary. So if you're weightlifting, weight training, you may need more. Extra virgin coconut oil. Once the heat has not touched the product, the heat tends to change the molecular structure of the oils. So that is why we try and encourage the cold press as opposed to the other processed coconut oil. And of course, moderation is key. Even though it is good for you, we don't need to overdo it. Yeah.
What kind of water do you drink?
I drink personally.
That's the question.
Okay, I drink alkaline water.
And with your recommendation, I'm assuming based on the question from Son Wolf, is that your recommendation to others that they drink alkaline water as well?
They can drink alkaline water if they can access it without issue.
Okay. This person is continuing along that path. If you know about hydrogen structured water,
No, I'm not aware of that one.
I would assume H2O, hydrogen is already there. So.
Is already there, so I don't know what that would, yeah.
If I had to choose one, should I sooner choose resistance training or cardio training?
Resistance training. When you do resistance training, you're actually working cardio as well. Because when I do my deadlifts, RDLs, you feel your blood pumping, your heart pumping. So you actually get cardio in when you do weight training, resistance training.
Totally agree. What is the best vitamin and mineral combination for older people?
For older people, I would put that to a physician on screen to go and give what's the best combination there. I wouldn't want to step into giving that one. Let the pipe water stand before drinking. That's okay. Let it stand, but then Have you ever noticed sometimes your pipe, all that whiteness inside, calcification happening? That's what's in the water.
Mm-hmm.
So we have to start to think and choose. Choose are hard. Choose. It's maybe costly at the beginning, but after a while, the cost goes down because our health is our wealth. The less we have to
Right.
spend because of the choices we make.
Agreed. Agreed. All right. Thank you very much, Magdalena. I'm not sure. Are you there?
Thank you.
Right here, back to Dr. Lisa. Dr. Lisa?
No, it's still you, man.
Okay, so it's still me. All right, so it's still me. All right, so are we ready for the next set of ads or promos?
Sure.
Thank
Sure.
you.
There's one video from the National Health Fund. We'll
Right.
play that now, and then I believe you'll introduce our third speaker.
No, that's somebody, that's Kellyanne. Okay, thank you.
Okay. No
Yeah.
problem.
Thank you. Mhm.
Members of the Jamaica Midlife Health Society, distinguished guests, and participants, on behalf of the National Health Fund, it is an honor to address today's online gathering under the theme, Empowering My Wellness in Midlife and Beyond. This theme strikes at the core of what we at the NHF are deeply committed to, which is ensuring that Jamaicans can live healthier lives, no matter their age or stage in life. During the midlife phase, early 40s to early 60s, wellness becomes more than just a goal. It becomes an essential pillar for the years ahead. Many Jamaicans face the reality of managing chronic illnesses such as hypertension, diabetes, cardiovascular conditions, and other non-communicable diseases. The data shows that 37% of our beneficiaries are 59 years of age and below. And of that number, the majority, that's 61%, belongs to the 45 to 59 age group. The challenges with NCDs may seem daunting, but they are not insurmountable. With the right support and management, we can navigate this stage with strength and vitality. At the NHF, we are proud to be a partner in this journey towards better health. Through the NHF card program, we offer subsidies on medical supplies, certain diagnostic tests, and prescription drugs that treat 22 chronic illnesses. This program is designed to alleviate the financial burden of diagnosing and managing various conditions so that you can focus on what truly matters, your well-being. The subsidized medications, which you can access with the NHF card, are available island-wide at any of our over 450 pharmacy provider locations. There are also the drug-serve pharmacies where public patients can get their medication free of cost. There are 106 of them located at government-run hospitals and select health clinics across the country. I also wish to highlight the Pap smear and prostate-specific antigen, that's the PSA, subsidies. With the NHS card, any female resident 21 years and older can access a subsidy of $1,300 every 3 years for a Pap smear, and any male resident 40 years and older can claim $1,600 subsidy for their annual PSA test. In addition to making medication affordable, the NHF plays a critical role in developing Jamaica's healthcare infrastructure, including the funding of new clinics and important upgrades at public hospitals. Empowerment in midlife means having access to the resources and support necessary to make informed decisions about our health. The NHF is committed to providing this. We recognize that chronic illnesses can affect every aspect of life, and by making essential medications more affordable, we hope to empower more Jamaicans to take control of their health, live longer and healthier lives. This is not just about medical support. It is about fostering a holistic approach to wellness, one that includes proper nutrition, physical activity, mental well-being, and ongoing education, all of which we actively promote. We commend the Jamaica Midlife Health Society for creating this platform for dialogue, learning, and encouragement. It is through events like these that we as a community grow stronger. We will surely continue to work with you as you promote health at Midlife and Beyond. In closing, I would like to reaffirm the National Health Fund's dedication to supporting the wellness of all Jamaicans, especially as we navigate midlife and beyond. Together, we can face the future with confidence, equipped with the knowledge and resources to live our healthiest lives. Thank you, and I wish you all a successful and enlightening webinar that will lead to healthier lives and improve well-being for all.
Thank you, NHF. Next video.
No, not next video. Actually, at this time now, I think we introduce our
Okay. That's Kellyanne.
right.
Yes,
So we
over to you.
introduce our next moderator for the next session, who is Kellyanne Chin,
Yes.
Assistant Public Relations Officer for the JMHS. Kellyanne, over to you. Kellyanne, I hear you. You unmute and everything, but I'm not hearing you. Does your microphone itself have a mute button? While Kelly works the kinks out, again, I want to thank everybody for joining us for the Jamaica Midlife Health Society's third webinar of 2024. This one, of course, entitled Empowering My Wellness in Midlife and Beyond. Where am I now? I want to thank all the sponsors who have presented and those who are left to come, who truly make this possible for us to meet this way, have this type of a conversation, and learn about how to deal with midlife and the challenges that they may face. Kelly, you okay? You there?
And learning is lifelong. So therefore, every time we come to a webinar, we have the opportunity to learn something new.
There were a few questions that didn't get asked while we're waiting on Kellyanne that were in the chat. You want to do them, Sam? And maybe, like, do you have to boil the water, good or bad, and what it represents? That was in one of the questions in the chat.
Sure. So for our first two presenters so far, just a recommendation. This is a very interesting question. Is it okay to eat eggs every day? I think my question would be how many eggs, but yeah. So for our presenters so far, Dr. Jackie, if you're still with us, and of course, our nutritionist, Miss Jones, any advice on eating eggs every day?
But how many eggs? Why would you want to eat eggs every day? You vary your diet.
Yeah, I've actually
Not very
seen where
far.
persons recommend that you eat eggs every day to get your recommended dose of protein.
You don't have to eat. There's so many sources of protein. We have our plant-based, which is not just giving protein or fibers or vitamins or minerals. So we want, when we are eating, we are having a nutrient food, a food that is giving us all we need, instead of just having one item specific to one thing. You know what I mean? We want to vary. We want to have a variety when we are consuming. So the one egg every day, if you choose to do that, but no, I wouldn't suggest doing
You
the
would.
egg every single day.
So your recommendation
Limit
is
how
one every
many
day?
days. No, I wouldn't recommend that egg every day. No. You boil your
You,
water for food safety reasons. And for some people to help with the minerals that might be in the water that they want to get out. Boil it, let it sit, let it stand, and then they strain it off and use it. But mostly the boiling is for food, is for safety, so that if there are microorganisms in said water, you know, it is clean for drinking.
what's your feelings on persons who are asking about drinking pipe water directly from the tap?
If you feel you're getting a safe water supply, you can have it from the tap. It's better you drink water than have no water if you're looking at your options. Better you have water instead of no water, because you need to be hydrated, especially in this heat. You can't afford to buy bottled water, alkaline water, all these things, but you have access to the water. You use what you have until you can do better, you know, for yourself.
I don't have access to any data, but I believe Jamaica is one of the first countries in the Western Hemisphere to have running water through the pipe, and I think
considered safe too.
which is considered safe. And
Yes, even the
I've
ships
not
that come here,
been
they get the water. Yeah.
right, because I've not been advised that travelers, tourists, when they're coming, are given warning advisories as far as not to drink the water. I've been to a couple of countries
Yes,
near
and they
to
tell you not
us
to drink
where
it.
you're warned not to drink the water.
Let me comment a little bit. Jamaican water, because of the chlorination, doesn't really have any infectious diseases, so you're not going to catch any of those.
Yeah.
Coming from the rivers and our soil, we do have a fair amount of heavy metal, calcium, that sort of stuff that's in there. So some people therefore prefer to filter that, but you're not going to catch anything.
Fair enough.
And
I
can
can
ask
say, because it was mentioned about the gardening earlier by Dr. Jackie, if you really want to have a green thumb, try not to use the pipe water because of the chlorine. So where you can, try to collect rainwater.
You know, that is something that I do. I catch rainwater
to water the
for my plants. And interestingly, many of my patients catch rainwater to drink, but they have a system where they put it through charcoal. Yes, they have
They
their
filter
own
it.
thing. At my house, I will drink water from the tap because the water from my house, actually tastes nice. So I drink the pipe water. Other people may not be so inclined.
No,
But
I agree. Every time I visit my parents, I drink the tap water.
It tastes nice.
It's
Yeah.
very delicious. But
What
maybe
about
I'm sure it's
sediment?
different taste. What
What about
about Dr. Brown Morgan?
Yes, what about sediments from the frequent water lockups? Because remember, we are a country dealing with frequent on and off, and that water is either our pipes have nothing in it and with rusting, or there's we're getting it from a tank if you connect tanks, which are also stagnant for a while until we have to use them. So we drink a lot of stagnant type.
You could attach a filter, you could attach a filter to your pipe on the outside from the supply coming into your house. You attach a filter there to help that the water coming into the house, some of that is not getting into your supply.
Yes, I don't mean to interrupt you all, but Kellyanne, what's happening, Kellyanne, because we are running behind schedule?
Trying to reconnect her audio.
Magdalena, I will take over.
Okay,
Miss
fine.
Arlene.
Okay, go ahead.
Okay,
Hold up the conversation, guys.
Thanks, everyone. Welcome to our third webinar. My name is Arlene Brown, and I'm the Marketing Officer for the Jamaica Midlife Health Society. It's my pleasure to introduce to you Subhadra, also known as Sandra Griffiths. She's the founder of Yoga Angels International. She's faced many challenges in her life, and right now she's facing her biggest challenge as she lost her husband recently. So can we give a few moments of silence for his memory, please? Thanks. Thank you. Um, she has achieved a lot. Um, there, she has received global recognition. Her accomplishments have been featured in Forbes magazine, and she has made significant impact worldwide, especially in California, Kenya, and Zanzibar. Her dedication to yoga has led her to train hundreds of yoga teachers worldwide. And through Yoga Angels International, she has a training and certification program. She is renowned for children's yoga program in Beverly Hills, and her commitment to yoga and wellness extends beyond her professional life. As a mother of four young adults, her family has brought yoga and wellness to unconventional places, including Jamaica, right here in Jamaica. The Jamaican Youth Correctional Facilities funded by USAID and OAS. So, with an unwavering commitment to enhancing well being and sharing the transformative power of yoga, Subhadra has launched her podcast called Strip to the Naked Truth, expanding the reach of yoga angels while sharing her life's journey. Please welcome our yoga, our yogi, our master yogi, Subhadra. Thank you.
Thank you so much. Such a nice moment of silence for my husband, Ryan Riley. He passed away 2 weeks ago. We're here on the midlife. We're saying midlife is our time to kick it up and take care of ourselves. But my husband was only 38 years old and would have been 39 2 days ago, or three on Friday. And I say that maybe midlife is a little bit, let's think about what his midlife would be then. That's what I'm trying to say. So our midlife, we have to realize that probably our midlife is not quite where we think over 50. It varies according to the longevity that you are given. And I think that we've had so many speakers and they're so amazing. The first thing I want to do is give thanks on the equinox that I'm sitting here with such educated, such dynamic people. And most of all, if anyone know anything about me, I love Jamaica. I'm not a person who can walk out and not be in celebration of my country. It's one of my branding aspects of my branding. My children, my four children, though they were all born in America, you can't really deny that they have a rootsiness about them, and that came from the fact of the love I have for my country. I ended up marrying into the entertainment family of the Rileys, and Jimmy Riley, Taurus Riley, and then my husband, who is artist named Kush Riley, but Ryan, Little King. And that's not an accident. That's a part of the celebration of the culture and the lifestyle I live. I too started gardening, and I must say the tomato thing is an amazing thing. So thanks for all of that. When I saw the tomatoes, I get extra excited because that's the fruit I'm being given now. And I would love to just take us in movement, because as much as I would love to sit here and tell you what you already know, I think it's almost underestimating what has already gone by. There was so much amazing information given, and we all know these things. We're very smart people, but I think what it comes down to is, are we really applying them, and are we applying them consistently? So I want to introduce you to my 25 minutes. That's the extent of my conversation. And thanks for all the condolences. Though I won't interrupt and go into the chat and write back, I would like to say thank you so much. I see you say condolences to Ryan. But without further ado, I would love to know from everyone, where are you? Do you own a chair? We all do. We all have a chair in our house somewhere. And a chair, to me, is one of the most magical furnitures that we can have, because you can create miracles and health and wellness on a chair. We're going to use a chair if you have one. If you don't have a chair, don't worry. There's so much we will do in this 25 minutes. The point I'm going to try to make is, let your body do the talking. And you have 5 limbs. So if you're sitting down, let us pop ourselves up and let us stand up. And I want to introduce to you your anatomical system. Now, I know you know all of this already, right? So I'm going to stand up, and I hope you're joining me, because I absolutely can't see you, but I'm trust that you're all up on your feet and ready to go. I'm barefooted. You're welcome to have shoes on whatever you're wearing. If you have on a jacket and it's restricted, take it off, get loose. Your legs, I want you to use your imagination now. When you were a little girl or a little boy, you were given a doll of some sort, and the legs can pluck out of the hip socket. Pluck out 1, 2. The arm does the same in the rotator cuff. 3, 4. And the one part of the limb I want you to really think about is your head all the way through the pelvic region to your tail. That's your 5-limb system we're going to work with today. So whether we are sitting on a chair, and we're going to go between both, or you can do it all up, or we're standing, we're going to move and watch what these 5-limb system is doing, and how quickly we can touch cardiovascular, core, I think some of the things I wanted to touch, and then your breath, your emotional breathing. I'm going to flip the presentation, because I hardly ever use a presentation and go through it step by step. And I'm going to put your breath at the end, your breath work, because as I was here for the entire seminar, I saw that it would be just so lovely to end with your breath. And that's the one thing we cannot live without. So we've spoken about so many areas of our lives that will bring us to wellness. And I think it was Dr. Jackie. She spoke so extensively about wellness and health and how they differ. And I absolutely agree with her. You need to take the wellness journey to find optimal health. That is facts. So one of the areas I want to say is, let's begin to move right angle with your feet. And this alone, if you can stand and just lift up your right foot and see to a right angle, and that would mean your knee would come to your hip, and you lift up your left arm or your right arm and do the same, elbow up to shoulder. We're never going to do much more than that. We straighten, we bend, we straighten, we bend. We bend, we straighten. That is as much as we're going to do throughout the whole thing. And then if we're sitting and we're not standing, we're lifting, we're straightening, we're bending. And then the torso, there's not much you can do with it except bend it forward, lift it up, and magnificently we twist. Those are the movements we're going to do. Are we ready? I'd love somebody just to give me thumbs up or whatever, so I know that we're all ready to go. Yes?
Ready.
My love, ready. So let's get ready, steady, flow. So are you up on your feet? This is now where you get interactive. You have been so patient and you went through so much sitting down and listening. If you're on your chair, stay there if you don't want to get up. First thing is right and left and right and left. Everybody marched at one point or another in their lives. But what I want you to think about is, how can you do that? Don't stop moving. Take your arms out to the side at the same time and do the legs moving. Now the tummy must go back. You know, in my 50s, I'm 54 now, and one thing I would not have is my organs protruding forward. How do we stop that? We suck in. We pull the organs back. Don't stop moving your legs and breathe. Now, bring the arms at a right angle. Elbows are up in line with your shoulders. Control your landing. If you're here doing this, no, you're sucking up through the archings. You're sucking up through your belly button, your pubis, everything lift. Now, can you just swing the arms with the knees? Coordination, so basic, but it can make you active. Keep going. How about you put a little turn into it? How are you landing on your feet? Yes, take that right elbow up again, and it's just right here. Well, how about you just go in and out? And now, where is your head? In line with your tail. Make that straight. So the upper body stay up. And this, imagine there was a song playing. A song goes for about, what, 2.5 minutes, some 3 minutes. That's what you would do. One movement to the length of a song, and you can change the variation. Are you still moving? Give me a feedback. Are we moving?
Yes, yes, yes.
And that is
Yes,
all
yes,
we need.
yes.
The arms moving. Bring it up again. We are almost done. Our song is about to be completed. Now, can you take the arms straight up? They're just going up. Stiffen them. But the legs are marching. They are marching. And our song, kaput. Take a break. Stand with your feet together. Look straight ahead. And start to breathe in and out your nose. Feel your heart rate. You agree it has changed. It has changed because you have just give yourself a nice little jolt in your cardiovascular movements. Now, what about the fit ones in the group? When we were doing this, you could have been doing this. We all skipped at one point or another, right? So you can go low impact, middle impact, high impact in anything you do today. Now, let's move to our next move. Very simple. One arm, one leg, and we go back and forth. The standing foot is the balanced foot. So let us push down on the toes and draw the elbows around the opposite side. Suck in your belly. Soften the standing foot knee. Breathe through your nose. This is core. This is the torso. So you want to keep the movements nice and steady. Sink into that bottom foot. Spread out. And turning, sorry, I got a call. Breathe, turn, breathe, turn. Now there's another 10 more to go. So you keep going. You pull in the belly. Remember that? You breathe in. On the exhale is when you're moving. So coordinate the breath and the movement. And the last 5. Keep breathing. Keep breathing. Keep the elbows in line with the shoulders. Remember the right angle. And stop. Next leg. Now, what if you were not standing? You admit you can do this on the chair, right? You can do this on the chair. There is no excuse for us not to move. You don't have to even stand. Yes, here we go. Next side. Hand on the hip, right angle, right? Now, sorry, right angle, and go. Make sure again you soften the knee.
Make sure that standing foot knee is nice and soft. The foot is pushing in the ground and you're lifting the knee high as you can, right? Some of you, you're expert. You can be like this. You can use the arms and go, belly in and twist and kick and lift. There are others of you who probably are so much expertise that you can even straighten out the leg, but you twist and kick, right? But you must know, am I turning it down or am I turning it up? Am I in my first level, second level, or third? You're almost done. Keep breathing. Inhale through the nose, in and out. And exhale. This is the last 10. Keep going. This is 3. 5 is gone already. And this is 10. Take a break. Now, that's your core. You're making sure your kidney, your liver, your spleen, they're being juiced. So you're turning. Let us bend forward and hang our head down, bringing some blood to the pineal gland, the pituitary gland, and breathe through your nose. What if you're not standing? You're doing the same thing. You're sitting, opening your feet wide, pulling in your belly, and dropping your head down. What I'm saying essentially, there is no excuse for us not to do some form of movement all day. Every single day you can move around even in between your workload. You don't have to wait for morning or evening specific times. Just make sure your body moves. Commit to yourself. Drop the head. Then we're going to take the arms up on the legs if you're on the chair and bring the hands behind you. Now, if you're standing, it's no different. It's the same thing. But if you're on the chair, you're just sitting. But if you're standing, the legs are just straight, but you squeeze that shoulder blade, the scapular. You must push it into the chest. I'll show it sideways as well. The feet must press, and the breath in and out the nose. Inhale and exhale. And remember, you're here to relax. As much as it's challenging, the hamstring, back of the leg, push the front of the leg back and tighten the muscles onto the femur bone. That's the upper thigh bone. Grip every muscle onto it and lift up your buttock bones. Make the interlation of your fingers stronger. Inhale through the nose. Open up your toes. Stretch back in your heels and dig your outer feet down in the ground. Pulling your arms up out of the shoulders and over the head. Bend the elbows. Keep the head into the chest. Bend the knees. Keep the head into the chest. Pull in your belly. Keep the head into the chest and roll up from the belly like a rag doll. Come up with your head last. Heel toe your legs back in and give me a feedback. How are you guys doing so far?
Great, great.
Good.
Good,
Good.
good, very good.
All right, now you're going to come up onto your feet. Now remember, everything I'm doing here, you can do it on a chair. So I'm just going to quickly show you that if you're on a chair, whatever we're about to do, you will be doing it something like this on a chair, right? If you don't need the chair, just think about your balance and open your feet underneath your hips. As wide as you stretch your arms, you're stiffening them. Everybody remember, how many limbs did I say we have? 5. Yes, we're going to move all 5. Turn your right leg out to the right. and keep your pelvis straight upright. Remember the fifth limb? The pelvis belongs to the torso. Pull upward and stiffen your arms, stiffen your legs. Now take the spine to the right side, touch your shin in the middle. This is called triangle pose. I love this pose. Pull in your belly, turn up your chest to face the ceiling. So you're rotating your ribs around to the front. You can look down, you can look forward. And the most challenging one is to look up at your thumbs. Your thumb. Take a deep breath, press down both feet and the toes, pull in your belly, pull your torso, pull your arm, come right up. You can rest your arms, turn the right foot forward, turn the left leg out to the left, stretch the arms, push those shoulders down, suck in your belly. Here we go. We're reaching to our next side, triangle. This particular triangle pose, take the measurement of your right leg being straight, push it back. Your left leg being straight, push that back. And your pelvis, your waist, your spine, pull forward towards your foot, your right foot. Breathe through your nose. Now, if you're on the left side, which is the left leg turn out, then move to the left because I'm mirroring you. Pull your belly in, push into your feet, pull up with the arm, come on up. Hands to the hip, turn the foot forward, turn your right leg out. I'm on my left. Don't forget I'm mirroring you. But turn your right. Arms out again. That was triangle. This is a warrior two. It looks so simple, but so demanding. It's like a brand new baby. Beautiful in stature, but absolutely demanding. Be hyper aware of your feet. Push them into the ground, especially the little toe side of the back foot. Drop your shoulders down. Look over your middle finger. Smile. Breathe. Lift up the back of your head. And hands on your hip. Turn, straighten the leg, and turn the foot forward. Turn your left leg out to the left. And the foot. Stiffen that right foot. Stiffen that right leg. Arms are out. Sit the hip down on the left. This warrior two stance is really demanding. Remember that. So breathe. Shoulders down from the ears. Look over your middle finger. Spread out your toes. We dive from our feet up. Our extremities, those sensory nervous system, we must keep them alive. Look at your middle finger. Breathe and smile. Lift up the pelvis. Lift up the chest. Turn the navel towards the right. Relax the arms. Straighten the leg. Turn the foot forward. Reach forward with the pelvis. Push back with the legs. And drop your head. More blood to the pineal gland, the pituitary gland. The brain must relax. Inhale. Exhale. Try to inhale and exhale through your nose only. Calm in your nervous system. Inhale. Keep those legs engaged and straighten. Lift your buttock bones up and dig your heels down in opposition. Broaden your back and bend your elbows out to the side. Grip your ankles with your hands. Pull in the elbows apart. Pull in the head down. Lift up the buttock bones and place that tailbone above the crown of the head. One straight line through the spine. Now bend your knees. Put your head into your chest. Pull in your belly and roll up like a rag doll. Head last. Heel, toe, yourself back in. You're back into mountain. Here is your 5-limb system. Arms are up, right by your ears. Can you make your legs one leg? If there's a space between your ankles and your inner calf, squeeze them together. See if you can make it disappear. Good luck. It's not as easy as it sounds. The legs, the arms, the spine, that's where, and your brain is where your nerve endings are. You see all those interweaving of the nerve endings. So make sure, bring the arms out and down, that you can feel your arms and your legs. Let's do that again. Inhale, the arms out, and they come up by your ears. Just doing this can raise your cardiovascular. Reach the arms, reach the waist, press the feet, open the toes. The most important thing you should be doing is a squat. Now, can you do this squat without holding on to something? Maybe not, but there's always furniture in your house. Use the furniture to help you to squat, but find a squat. What about a desk? And open the feet wide as you need them. Some people, we can squat with our feet together. Some people cannot. You must know where you are. Some people, your hips are maybe here. Hold on to something and begin to pull back with your buttock bone, dropping the hip socket. A squat happens in the hip. The knees follow the hip, not the other way around. Don't try to bend your knees. Try to bend your hip. So let's come up and down a few times. Hold on to something if you must. Pull up through the pubis. If I have to recommend 2 things to you, it will be learn how to squat. Learn how to come in and out of a squat. For those fit people, you can learn how to bend on your knee. Learn how to lift, turn, and bend on your knee. This will tell you how aged you are. You push down in the foot, turn, and try to go down. What if you can't do this on your own? Use your furniture, people. They're not there to kill you. They're literally there to save you. Hold on to something, but take your time and allow your hip to bend, right angle again. Some of you can do it like this. Now, I'm not going to tell you it's going to be easy for everyone, but I do know if you pull up from the perineum, pulling up through the 5th limb, you will be able to get better day by day. There's one more I would like to show you that is used for testing your age. Crossing your legs, getting that vagus nerve to fire up. But when you cross, trying to sit. And you don't have to go fast. Everything you do can be slow. You can hold a chair. That's the harder one, when you have to spin and then sit. When you're going down, you see, you still have to feel a push and a lift. Yes, anybody trying to get that? If the knees will not allow you, it's your hip that will make you do this, not your knees. Your knees will follow. So don't go all the way down. Hold on to something, cross the leg, and just sit the hip back on the outer feet. Wherever you get, you stop and honor that. Pull in your hips, pull up your perineum, and come back down, up. Then you go back down, holding on to something, pulling on to something. And each time, then you turn. Each time you will go a little further down. Everything around me, something. I didn't see what that says. But I will hope that we can go over those. I don't want to overstay my time, so I'm going to try to watch, and I want to leave a little time for Q&A. I'm not going to talk about what you should eat. I'm vegetarian, so we can get into that in the Q&A. But in the meantime, try to squat and try to use your furniture to heal you. There is another thing.
The time is up.
So, I'm sorry?
The time is up.
Oh my God. So quickly.
Yes.
There's no time for talking.
You can still have
However,
questions.
we have gifts for you. We have gifts for you. I've given a monthly free yoga online with me. So you can join me online daily if this time works for you. So please, the presenters will, I would think someone will be able to give it to you. We also have a YouTube channel that I give away free yoga classes. I believe everyone should be using YouTube and utilizing all those free classes we give. You don't, if you know, there's no need to not do it. We're growing golden. That's the word I use for it. And as we become golden, isn't it only right that to suit our wisdom, we look beautiful? We must look and feel beautiful in this world to be able to shine and give beauty. Yeah? In the meantime, any questions for me? Nutrition, eat live foods. If it's picked from a tree, that's the food you want to eat. If it has natural, beautiful colors and it's made by God, eat that baby. The rest of processed stuff, keep it out of your mouth. Someone said something that I love, and I always quote this: don't take your tea time, dig your grave. No need for that. We're going there anyway. Let's go there looking like we're going to bashment. If you're Jamaican, you know what I'm talking about. We should go looking good. Yes? And feeling good. Any questions for me?
You're looking good because you're feeling good.
I agree. I'm going to agree with that. I mean, yes, life is going to bring every sorts of curves and turns in our lives, but we must be able to just be flexible. That's another reason to do yoga. The flexibility of the mental body, the physical body, they should be aligned so you can deal with life changes. They're going to come. I hope that was good for everyone. You got a little, hopefully a little warmth and a little turn up of your gastric fire, and your immune system is great workout. I like the word workout right there. Good. Join us anytime online, please. I would love to have you, all of you, and your friends and family, and let us be the community for each other that we all talked about. That's how we do this. We remain connected, and we must then take care of each other. It's our duty.
Amen. Any
I
questions,
think that's it for
Sam?
me.
Sam, any questions?
I think just a lot of kudos from everybody. I think the presentation itself being so active and interactive was just amazing. I could hear other persons, their microphones coming in and out, in and out. So I know that was the movement that you were seeking. The microphone was turning on, turning off. So thank you so much, Sandra, for your wonderful, wonderful presentation and your charge to keep moving and to stay together and to breathe, eat, and speak life. Really, really wonderful. I think
Do we by
now,
chance have 1 minute? 1 minute? Do we have 1 minute? I could teach a breath work that I want everybody to walk away with. Is that possible?
I think you sure, definitely, please do, please do.
So if we all could sit with our eyes closed, and this, you know, this breath of fire is about balancing your brain. And there are just days your brain is going to feel just not integrated, and you want to balance the front lobe, back lobe, side lobes of the brain, and really feel in that oneness. So the chin touches that notch between the collarbone. The throat go back. That's actually throat lock. That's a whole other system of yoga bandhas. And we take our hands and we rest it on our legs. You could be laying down for this as well. Just put a back pad behind the back of your head if you're laying down. And you're going to blow your breath through your organs pushing your organs back and through your nose. So it looks like this. If you put your hands on your tummy, you should feel the navel and the organs pushing back, and you can speed it up or turn it slower, turn it down, up or down. Don't stop doing your motion, but notice your motion, notice your breath. What are you doing? Are you slowly doing it, or are you medium, or are you fast? Find out which one do you need. Expel the energy out the navel, out the organs, and out the nose. This is purifying the organs. You can touch the tips of the fingers to each other. That's another system of yoga mudra. Put it, cup the navel with it, and breathe out. Gaze down at the tip of your nose. Release your hands onto your thighs, palms up. Relax your tongue, your lips, your buttocks, your back, your jaw. And watch your breath. Watch the breath enter, watch the breath leave. Relax your buttock flesh. Take a quick assessment of yourself right now. Where are you emotionally? Where are you mentally? And how are you feeling physically? If we can just maintain equilibrium in those three bodies, the rest will naturally interact and you will be then moving further and further forward in your wellness. Gently winking your eyes open, gazing down. That is breath of fire. And that is just one feel, I feel light. That's exactly what you did. You begin to turn on your light body, which we might call the spiritual body. We can go on and on about what that body is. Feels relaxed, exactly. So there's no reason why, no matter what life gives us, we have tools. We can demand, command, apply, and change your state of mind. One breath, 1 minute. That's all it takes. Then the rest happens after. Namaste.
Namaste. Thank you so much. Really, really, really. Thank you for sharing with us. How wonderful, how powerful. We really appreciate it. We move now to a midlife check-in video presentation. Please pay attention. You might know a few of these persons who are acting. It's been produced and directed by Miss Arlene Brown, who's our social media marketing officer, and it features the President William Brown, Dr. Arna J. Brown Morgan, and of course, Dr. Lisa Kervin Dawes. Please enjoy the video, and thank you once again for your participation and spending your afternoon with us.
Let's empower wellness. Cheers. Cheers. Cheers.
Perfect.
Guys, it's been a long time us getting together. We really need to do this more often.
I'm telling you, when I heard that William was back in the island and, we've both been talking about health issues, I just knew that we had to come and talk with you because I know you're a health buff and you could probably get us started off fine.
Well, yeah, I've gotten more into being holistically healthy, wellness, the mind and the body working together. So doing more meditation, more clean living, better food. We still do our little,
Yeah.
our little stuff, but eating better and doing more exercise, more yoga.
William, you just coming from the doctor's office? You said you went to the
Right, I
doctor's
just
office.
came in Ireland and I said, no, I have to see my doctor. I haven't been to the doctor for a long time, And I felt a little bit, heavy and groggy. Because at 60 plus, I should be, more energetic. And I just can't find the time. My busy schedule doesn't allow me to organize time for meditation, like what Lisa is saying, and for exercise. I try sometime, but it's not structured. So when I have a little time, I do a little, but it's not adding up.
I'm
So what do I
finding
do?
the same problem. The same problem as I've gotten older, more responsibilities, and much less time for me.
Exactly.
And exercise is the first thing to go. So how do we get back?
I do short periods. I say short periods in the morning. You can do even 7 minutes. 7 minutes of yoga, 7 minutes of walking, 10 minutes, walk around your yard. If you have a little hill, walk up and down the hill for 10 minutes.
You're getting too long already. The 7 minutes can work. I think it's going to happen also.
All right. I said 10 minutes going up and down the hill, but 7 minutes is good.
Yeah.
I think William does his walk running. I mean, some people can do walk and slow walking.
Yes.
So there is one of the things they recommended now is 3 minutes fast walking followed by 3 minutes of slow walking. Do that for about 15 minutes until you gradually increase.
Right.
Oh boy.
Okay.
Is your kitty cat?
Yeah.
And see, animals actually add to your wellness.
Yeah.
Really?
Pets.
Yeah, okay.
Yeah.
Okay.
Definitely for your wellness. I can tell you, boy, when I lost my dog, it was like I lost a part of myself. No, and the joy. I tell you, when that dog I come home and the dog will come to the window and look at you with those adoring eyes, and you just say, somebody loves you. Oh yes, somebody loves you.
But talking about this exercise again, some people are talking about yoga. Yoga for men, yoga for women.
Yes.
I mean, what's the benefit? I don't see it adding up.
Yoga, okay, so yoga does many things. It actually helps the mind, helps to balance the mind. It strengthens the muscles without jarring them like some other exercise. So as we age, we get our bad knees, our bad joints, our bad hips. Yoga can actually help strengthen the muscles around it. It gives us more flexibility and more balance. As we age, we are prone to falling because our muscles are weaker.
I'm telling you something, you're not saying something that doesn't resonate. I had a friend fall today and she called me and told me she broke a rib.
Wow.
And 3 weeks ago, a friend fell and he broke a rib.
Wow.
And earlier this year, a very, very good friend fell and he broke 11 ribs.
What?
11 ribs. So you need to understand that I absolutely am petrified. The bones are thinning maybe, I know there's medical care that perhaps I need to get for some of this, because I know that some people take tablets.
The issue of balance. I think the issue of balance is
balance
also part
and
of
muscle
it.
strength.
Yes.
And proper vision,
And
because
proper
so many
vision.
people
Excellent.
are getting all kind of bad eye issues,
Yes.
the cataracts and the
But you have
glaucoma.
to remember, in empowering our wellness, it's not just the medical, but we also look at the financial. Doctor was also saying you have to look after your financial wellness, and at our age, we have to be careful how we handle funds, how much comes in, how much goes out, and how we balance this. How do you guys do it? Because I'm struggling to make ends meet, and whichever way I turn, my accountant says, no, you should have done it this way.
But the truth of the matter is that as we are getting older, that's when it begins to resonate. Whereas it should have
Done it earlier.
much earlier. In fact, what we hear is that from we get our first job, we should start.
So talking about savings from childhood, we're taught how to save, little bit at a time. At the end of the day, you are 40 and the savings, they're not growing. So what other forms of savings could you, or investment, they're talking about generational wealth. How do we generate
What do you
this
tell your
positive?
kids?
I don't tell them anything. I tell them to. I don't even tell them to save. I save for them when I can through life insurance
No,
and
but we
all
have
kind of
to
things.
We have
treat
to
them
train
how
them.
to be fiscally. I think they need to learn.
But you
You
have
know, we're
financial
getting into some
advisors. You have
serious.
financial advice in all the financial institutions, and they help, but sometimes it's to their own
You
advantage.
live what you learn.
Mm-hmm.
If they see you trying your best, they are more inclined to save. If they see you fritter,
Mm-hmm.
I figure they're more inclined to be more frivolous with their funds.
Okay.
And always think, oh, you know, it's just been great chatting. We have
Yeah.
to get together
We
another
have to get
time.
together
Right.
more. This is actually great for aging, just camaraderie.
Yeah, they say there's I'm reading about this, and they're telling me that this meeting is something we need to do
Much more
very
often.
Because it's
frequently.
good for our mental health
Health.
also.
Yes.
All
Yeah.
right.
They say Alzheimer's. Oh my
Right.
God. When you meet
Yes.
with your friends and you chat with your friends and you laugh with your friends and you walk with your friends,
Mm-hmm.
you just stay together for a longer period of time, mentally
Okay.
healthy.
Okay. Lisa, thank you for having us. We really enjoyed the
need to
time.
come
But
by.
Let's empower
our
wellness. Cheers.
Cheers.
Cheers. Cheers.
The next item on our agenda is your post-test question. So I will do the post-test question, and I think at this time I invite our president, Dr. William Brown, to do his summary and closing remarks. Over to you, Dr. Brown.
Too bad. It's supposed to be your 5 o'clock, so you're not doing too bad.
Hello, hello,
Hi, Doc.
hello.
Yeah,
Can you
hearing
hear
you
me
and
and
seeing
see me?
you. Yep,
All right,
yes,
so
we
we're
can.
going to do it very quickly because time is base background. Right. So thank you all. Just to do a quick summary. Time is really against us, so just take the opportunity to thank Professor Asnani for reminding us that in midlife we are well positioned to look back and to look forward. She even said something like, having been in medicine for a long time at the university, she didn't know anything about JMHS. Now that's a red flag for us that we're not reaching the persons, the doctors and the non-professionals. So JMHS, the challenge is on us. We have to go out there and teach persons, educate persons how to live in quality and quantity lives. All right. Thank you very much, Prof. and Asnani. You'll be thanking both of thanks. But and our second speaker, or the first speaker, Dr. Jacqueline Campbell, achieved. She made a distinction between definition of wellness and health. All right. And what I gather from it is that health is a destination, but wellness is the journey to the health. But I kept on thinking, but your health can change. And therefore, the destination changes. But then the wellness, the process by which you get to destination has to be improved. She went on and said, wellness has a direct effect on health and is not just taking medication, which is wellness. Wellness, not at all taking medication, all right? It said the person who prevents diseases is more proactive and is more of a responsibility to your health. So I put the 3 P's there: prevent, be proactive, and promote, or be prepared. As you prevent, you become proactive and you get prepared for the future. The health is the goal and wellness is the active process of achieving health. And that healthy lifestyle, we all know the components of healthy lifestyle. She emphasized exercise, nutrition, meditation, relaxation, sleep, etc., etc. Physical wellness, she went into that. She spoke about sleep health and sleep deprivation and what it can lead to, like illnesses, fatigue, memory loss, forgetfulness, which people like to say instead of saying memory loss, they say forgetfulness. She said that was very aware. And then weakened immune system, Alzheimer's, etc., etc. Sleep apnea, which could lead to hypertension, heart disease. She spoke about intellectual wellness, stress, and how emotional wellness can help us better deal with stress. Instead of emotional wellness, she coined the term emotional regulation. That's interesting for me for the first time. Mental wellness, better than physical wellness or vice versa. The debate goes on. Which one is better? Or do we do both concurrently? She spoke on environmental wellness, social wellness with support groups, relationships, friendship, family. A happier and healthier relationship if you are socially well. And then she highlighted loneliness as an epidemic. You know, you might live alone, not loneliness, but you may live with a family or friends also in a group. But if everybody's on their phone, you are isolated at 60 and beyond. All right? So loneliness impacts physical being also. So example, dementia, sudden death. All right? Then she finally spoke about spiritual wellness and financial wellness, living within your means, set your goals, pay your debts, invest well, savings and all that. Occupational wellness, finding and maintaining satisfaction with your work and know the balance, work and family life, work and rest, the balance to prevent the burnout. And then when she spoke about the last item, holistic well-being, I was thinking whether it's a holistic with a W or the one without. But I said the holistic well-being is affected when wellness is affected. That is for you to have the whole, if, for example, you're not exercising, your whole part is affected. If you are not financially sound, well, the whole system is affected, all right? And then she finalized the whole thing by looking at benefits of midlife. It says, faded out the insecurities of youth life. So as young persons, you know, you have some insecurities, children and all that, pregnancies. As we enter midlife and over, we don't have those insecurities. All right, we are less selfish. We give more freely of our time and energy so that we may leave a worthwhile legacy. Interesting, eh? Thank you very much, Dr. Campbell. Then I came our second speaker, Dr. Shani Jones, and I was asking myself as she was about to start this question, is nutrition really the foundation of a healthy body? Is nutrition really, really the foundation of a healthy body? And at the end of her talk, I said yes, because why? Because the changes in metabolism as we age, we can't prevent that, all right? So we see chronic diseases, we see heart disease, diabetes, osteoporosis, because our bone density reduces, muscle mass goes down, hormonal changes, but there are some key nutritional needs as we reach midlife, all right? There's more protein intake for muscle maintenance, adequate calcium and vitamin D3 for bone health, fiber for digestive health, and cholesterol control. So these are some of the changes as we reach midlife. Weight management, bone health declines, all right? The chronic disease, the non-communicable diseases, chronic diseases, we have to be aware of them. And then she referred us to, Dr. Shani Jones referred us to a dietary guideline for JA, Jamaica in 2015. I need to get that book and familiarize myself with that. And then she went through the myths and the facts, you know, which of the groups of the food that we use, carbohydrates versus fiber intake, proteins, fats, cholesterol, trans fats. She highlighted trans fat. The trans fat tend to increase the bad cholesterol, all right? And the unsaturated fats, for example, avocado, will actually increase the healthy cholesterol. So she went into all that, explained very nicely. I was taking my little notes. Omega-3 fatty acids help the intellect, remember that. And she says we should focus on the mono and polysaturated fats more. And the supplements that we have to be aware of should have whole foods, all right? Vitamin D, B12 for the intellect and memory, and calcium for the bone. And then she finalized it by saying role of physical activity is very important. And sleep and stress management, she divided into two: nutritional strategies and lifestyle strategies. The nutritional strategies is to avoid the caffeine just before you go to bed, the heavy metals before you go to bed, increase your magnesium. That is very good for the nutritional strategies. And the lifestyle strategy, your regular sleep routines, your relaxation techniques, very, very comprehensive indeed. I love this so, so much. So with the relaxation techniques came Sandra. And Sandra, that was very, very good. You should give us like 1 hour one day, right? And so we summarize today is that we've had a good time and we've learned a lot. We're going to put that in practice. Definitely, these pointers are going to help us to empower wellness within us, all right, in midlife and beyond. Where am I? Where are you? All right. Magdalena, over to you. Thank you.
I don't think it's over to me. I think it's over to the next person.
Who is Debbie Meek, who will be doing the vote of thanks.
Right. That's correct.
Not hearing you, Debbie, you're muted.
Sorry. Good
That's
afternoon,
okay.
everyone.
Afternoon.
It was Marcel Proust who said, let us be grateful to the people who make us happy. And indeed, this afternoon's presentation has made us happy. So, on behalf of the Jamaica Midlife Health Society, I extend a heartfelt gratitude to everyone who contributed to making this our third and final webinar for this year, entitled Empowering My Wellness in Midlife and Beyond. Where am I now? A resounding success. First and foremost, to our esteemed presenters, thank you for taking time out of your busy schedule to share your insights and expertise with us. Your presentations were truly invaluable, offering practical advice and inspiring stories that we can carry forward on our wellness journey. Your passion for wellness, both in theory and practice, has left a lasting impact on all of us. A special thank you to Dr. Prashad Ashani for your engaging introduction, to Dr. Jacqueline Campbell for reminding us how to embrace a healthier lifestyle for a thriving future. Your contributions have truly enriched the day's session. We also want to express gratitude to Ms. Shani Jones, who presented on nutrition, the foundation of a healthy body. And I must say, thanks to you, I am more encouraged now to continue with my backyard gardening. Sandra Griffiths, Miss Griffiths, your session was very engaging. You have put the icing on the cake. Each of you has provided us with the tools and motivation to take control of our health and well-being, and for that we are grateful. To our dedicated sponsors, without your support, this webinar would have been impossible. Your generosity has enabled us to create a platform for meaningful discussions and learning, and we deeply appreciate your involvement. To all our attendees, your presence and engagement are what truly brought this session to life. Thank you for your thoughtful questions, comments, and energy throughout the event. It's inspiring to see so many persons committing to taking care of their charge of their health and well-being, especially on a Sunday afternoon during this rainy time. We hope the knowledge shared today empowers you to take positive steps forward in your wellness journey. Lastly, a special note of appreciation to the JMS team for organizing this impactful webinar. Every member played an essential role in ensuring that today was not just informative, but empowering. Your meticulous planning and dedication are truly commendable. A heartfelt thank you to our president, Dr. William Brown, for leading the team with such dedication and vision throughout the planning sessions. Your leadership and commitment to promoting health and wellness in our community have been instrumental in making today's event a success. Thank you once again to everyone involved. Together, we have all taken an important step toward a healthier, more fulfilling future. Let's continue to support and uplift one another on this wellness journey. We look forward to many more enriching events in the future. Thank you, one and all.
Thank you so much. And so now we go to our honorary secretary, Charlene James Devora, to do a closing prayer, as this is the final webinar for the year. Charlene, over to you.
Yes, good afternoon. Are you hearing me now?
Yes.
Are you hearing me?
Yep, hearing you. Yes.
Okay, let us pray. Father God, we just want to give you thanks for this wonderful evening, Lord, that we have spent together. It was very engaging, enlightening, informative, Lord. And I'm sure all of us have left or will be leaving, mighty God, more knowledgeable on how to take care of ourselves, live healthier lives. Mighty God, we just want to thank you for each presenter here today, mighty God, and may you pour into them as they have poured into us this evening. Thank you, Lord, for all that you have done and continue to do in our lives. In Jesus' name we pray. Amen.
Amen. Amen. Thank you guys so much. Have a wonderful, wonderful evening. Stay
Amen.
safe. Take care of yourself wherever you are.
Thank
Congrats,
you.
JMHS. We thank you for the opportunity. And we see you next year. Wow. Next year, 2025. Take care, everybody.
Excellent.
Same
Have
to
a
you.
wonderful
You too, Sam.
afternoon, everyone.
Thank you, Sam.